May 9th was the day my life began. As I lay on the operating table, groggily listening to London Bridge by Fergie, while silently searing at my ablated heart muscle, I found myself unable to take my eyes off the monitor displaying the electrical contractions under the guidance of my physiologist's hand. And in that moment, I not only witnessed the taming of the spasms that had haunted me for the previous 6 years, but also the realization that my life would be mine again. As someone with an invisible illness, specifically SVT, an acronym for supraventricular tachycardia, I oftentimes found myself at the mercy of my condition each day, constantly fearful of an oncoming episode. SVT is characterized by sporadic cardiac palpitations aggravated by nervous system overstimulation and faulty electrical wiring flowing around my heart instead of through. Activities that I used to take for granted on a daily basis, such as sitting, standing, laying down, any type of physical activity or lack thereof, would trigger these palpitations and land me horizontally in the floor with my heart beating out of my chest for 15 minutes at a time. But the truth is, you would not have known this if I hadn't have told you. You may see the girl who fills her schedule with extracurricular activities and academic validation, just trying to exert a minuscule amount of control over her hectic life, or you may see the one that's having another routine tired day. And if you look closely, you may even see her physically ground herself to the floor from a race with her heart in which her body will always come in second. But you may not see the fatigue, the brain fog, the years of physicians' appointments filled with unanswered questions, or the resilience it takes each day when no one knows just how hard it is to be functional. My SVT journey is shining a light on the ongoing efforts to lessen health disparities in rural communities. Obstacles such as a lack of access to specialists, medical facilities, as well as provider attitudes are leaving patients in the dark without options to improve their health. But by fostering resilient solutions, we may take actionable steps to reduce these health disparities and provide care for those in our region. Throughout my life, I had witnessed both family and community struggles due to lack of access to health care. However, I did not realize the severity until I was diagnosed with a debilitating condition. After 5 years of going to my primary care physician with limited answers, I was finally able to be referred to a specialist who diagnosed my SVT. However, it had progressed from small episodes of cardiac palpitations every few days to 15-minute episodes multiple times per day. For those living in rural Tennessee and Appalachia, access to specialists and medical facilities is a growing concern that is hindering treatment progression of many illnesses for the residents in our region. According to a study by the American Medical Association, there are only 30 specialists per 100,000 rural residents. And as 2010, in our home state of Tennessee, there have been 13 rural hospital closures, with 85 out of the 95 counties in our region being classified as rural. An example of this can be found in our backyard in regards to the Unicoi Hospital with the Helene floods. During this time, patients were airlifted off the roof. The hospital was closed, and the 18,000 residents of Unicoi County were left without access to hospital services. These statistics are alarming. They not only show the numbers, but the real people who suffer at the hands of a medical system that is not meeting their needs, and they are paying for it with their quality of life. A possible solution could be offering telehealth services such as the platform Teladoc that offers free phone call and video services by referring patients to one of their network of specialists, increasing accessibility. With virtual visits, patients would be able to receive the same care as if they went in person. And for those who are not as comfortable using technology, they would still be able to visit in person due to the newly freed availability. With the scarcity of specialists, patients are driving further distances and encountering longer wait times to get appointments with these physicians. However, some may be reluctant to drive these far distances due to inadequate transportation and monetary support. Additionally, provider attitudes are affecting patient retention. And in a rural setting, physicians are encountering the same patients more frequently than they would in an urban setting, and negative encounters can influence those patients to refuse care if their options are limited. During the day of my surgery, before I was taken back for preparation, I stood with my dad at the counter as he was beginning to pay the bill. And when I turn over my shoulder, I see the woman behind the counter high-five her coworker and scream that she had just met her sales quota of the day. As the youngest one to have her heart ablated on at this hospital, this not only caused tears to run down my face, but this interaction is becoming my inspiration to pursue a career as a physician. As in 2021, the American Medical Association put out an article describing the significance of intentional patient encounters because trust allows vulnerability, increased treatment cooperation, and significant patient success, fostering transparency through both patient and provider. A possible solution to this issue could be focusing on humanistic-centered medicine and encouraging potential students to pursue medicine as a way to serve their communities. In our backyard of ETSU, we offer a culture and health minor where students learn the importance of both health humanities and the social determinants of health. By exposing students to both clinical and volunteering opportunities, they may learn the importance of patient interactions. Organizations such as RAM Clinics and Miles for Smiles offer health, vision, and dental coverage for those who are not able to have health checks, while also giving students a chance to serve their community. As we look ahead, it is evident that rural communities have a lot of work to do to lessen health disparities, but with resilient solutions such as offering telehealth services and encouraging patient relationships through service, we may make significant progress to lessen these health disparities in our communities. This fix will not be easy, but nothing worth doing in life is easy. And in the end, resilience isn't just about facing adversity. It's about embracing it with courage, hope, and a deep commitment to change. And just as my heart learned to beat through the struggle, so must we find the strength to transform our struggles with rural health into something greater. The evolution from merely surviving to truly living with heart. And as I reflect on my 6-year journey with SVT, I know these disparities are real, but so am I. And with each beat of my heart in these episodic moments that I wish the race to cease, it never quit on me, and neither must we quit on equitable health efforts. Thank you.